Hello, my name is Nicola Wilson, and today I'll be doing an assessment on the abdomen and the GI system. My patient's already laying down so that we can palpate and inspect and auscultate their abdomen GI system. You also want to look at a patient's general appearance and posture because that could be indicators of abdominal pain, peritoneal pain, or inflammation as well. Given that my patient and I know each other very well, I know that their current state is well, given that they're comfortable, relaxed, not showing any distress of any kind, and that is good. Different patients will present differently depending on who they are and what their personality is like. That's important to keep in mind when assessing a patient. The first thing that one needs to do with an abdominal assessment is to inspect. Never palpate before inspecting or auscultating. Otherwise, that'll increase peristalsis of the abdomen, which could give us skewed assessment findings. When looking at the belly, I notice some striae, which for different people could be a normal finding. Skin color is pale, but given the complexion of the patient as a whole, it's to be expected. I see no pulsating. I see no visible peristalsis, which is also good. Depending on the age of the patient, you could find an abnormal normal assessment finding. In children, one could find a more rounded, protruding belly, but that is a normal finding for that age range. In an adult, if you see a protruding belly, it could or could not be a normal or abnormal finding. If a patient is pregnant, you expect to have a gravid patient. If it's a female who is not pregnant and has a protruding belly, why is that? Is it subcutaneous tissue? Is it inflammation of the belly? Those are things that will have to be further assessed through auscultation, palpation, so on and so forth. On further inspection, I can see the belly rising and falling as breaths are being taken, and that's also a normal finding within this patient. Next, we will auscultate the abdominal area. There's a few things we are listening for. Obviously, abdominal sounds, bowel sounds, where they are located. Are they hyperactive, hypoactive? Are they absent? If they are absent, one has to listen for a full 5 minutes to completely confer that there is absence of bowel sounds. Certain findings could be considered normal depending on the presentation of your patient. If a patient has bowel surgery or abdominal surgery, an absence or hypoactive bowel sounds could be a normal finding immediately post-operatively. But if a patient comes in with, say, belly pain and they're absent bowel sounds, that is not a normal finding and that needs to be investigated further. These things are important to keep in mind when assessing a patient. Furthermore, it will be necessary to auscultate the vascular system within the abdominal area. That would include the aorta and the venous return system as well. If a bruit is present in the aortic vessel, then that could be a medical emergency and that needs to be dealt with as soon as possible. it will sound like a whooshing sound. You can also have a venous hum, which sounds like a humming. That is also not a normal finding. Now we will go ahead and listen to our patient. Patient has bowel sounds in all 4 quadrants, normal, active, and audible, which is good. It is important to note the pitch or the tone of the bowel sounds, because that could also be indicative of hyperactive bowel sounds, which could be considered an abnormal finding. There is no venous hum, and there is no bruit present either, which are good findings. Next, we will move on to palpation. As mentioned before, it is very important to do palpation after auscultation. If done in the reverse order, the auscultation findings could be skewed and not accurate findings. First, we will feel for any tenderness. Be sure to let your patient know that that's what you're assessing for. Let me know if you feel any tenderness when I'm pushing on your belly. We're also feeling for muscle tone and just general characteristics on a superficial level of the abdomen. Any tenderness?
No.
The muscles of the abdomen are normal. There is no abnormal findings superficially, and the patient reports no tenderness, which are all good findings. Next, we will palpate a little bit deeper for any masses or bulges or anything abnormal within the organs. Some organs are able to be palpated, but given the presentation of your patient, those organs should be palpated for accordingly. I feel no bulges, no masses, anything like that. Be sure if your patient feels tenderness on your superficial palpation, that all other assessment findings have been collected before doing this. If a patient does feel tenderness on palpation, whether it's superficial palpation or deep palpation, it could affect further assessment findings of the patient. When I deep palpated the patient's abdomen, I could feel the aortic pulsations, but there were no abnormal findings from that, which is also good. Next, we will feel on the patient's umbilicus area for any bulges, tenderness, anything that is out of the ordinary for an exam. Everything on this patient's umbilicus area is within normal limits, and that's good. Next, we will be percussing the patient's kidneys on the costovertebral angle. In doing so, I'm right-handed, so I will place my left hand here, make a fist almost, and a knocking motion. The patient will feel the pressure from this, but if the patient feels tenderness or pain, this is an abnormal finding of the kidneys. Any pain with that? Do you feel the pressure?
Yeah.
Okay. With this exam, if the patient does experience tenderness, a further evaluation needs to be performed, whether that's with laboratory work, imaging, or anything that would help diagnose further. This is the assessment of the abdomen and GI system. Thank you.